For the next topic, discharge care. After completing the session, participants will be able to describe how to prepare a mother, parent, or caregiver for discharge, explain the importance of follow-up care for a new mother and her baby, identify community resources to support breastfeeding. All mothers need support to breastfeed after they are discharged. Research shows the more support a mother has from a health worker or peer counselor trained in breastfeeding counseling, the more likely she is to continue breastfeeding. In some communities, many mothers stop breastfeeding exclusively or they may stop breastfeeding completely after a few weeks or months. Difficulties arise in the first weeks and months, and if there is no support, it may lead them to stop breastfeeding. If they have negative family pressure to use supplements or need to return to work, these mothers will need extra support. Before discharge, mothers, parents, caregivers should understand how to feed the baby, responsive feeding, and how to recognize feeding cues, the importance of exclusive breastfeeding for 6 months and continued breastfeeding, the risks of infant formula and other breast milk substitutes, and how to get the ongoing support and help she needs. Prior to discharge, a trained health worker in breastfeeding support should observe every mother and baby during a breastfeeding session. This ensures the mothers and babies know how to breastfeed properly. If a mother is artificially feeding her baby, she also needs to know how to feed her baby. Mothers should be able to recognize feeding cues and feed their babies responsibly. It is often helpful to give written materials as a reminder. If a mother is discharged before her milk comes in, provide her with the following information about how her breast milk changes over the first few days after delivery. For day 1 to 2, colostrum looks yellow, thick, and is only produced in small amounts. If a mother expresses her milk at this time, a small amount, like a teaspoonful, is all that she may get. But this is exactly what the baby needs. On day 3 to 4, the appearance of the milk changes as the quantity increases. The milk looks thinner and whiter. It may even look more watery, which is quite normal. We should always reassure the mother that her milk continues to be nutritionally complete for her baby. Breastfeeding is going well if the baby is breastfeeding at least 6 to 8 times in 24 hours. The baby has at least 2 to 6 good wet diapers every 24 hours. The baby has at least 2 to 4 tablespoon-sized bowel movements every 24 hours. You can hear your baby swallowing at feeds, and your breasts feel softer after a feeding. Breastfeeding is also going well if the nipples are not painful. It is an enjoyable experience. And remember that if a mother goes home from a health facility in 72 hours or less, the baby should be seen by a health worker in 2 to 3 days, and again at 10 days to 2 weeks of life. For the warning signs, always see a health worker when the baby is having fewer than 4 good wet diapers a day by day 4 after birth. If the baby is having fewer than 3 stools or at least 1 tablespoon by the 4th day of age, or is still having black stool by day 5 or meconium, the baby is breastfeeding fewer than 8 times a day, and the mother's breast milk is in, but she doesn't hear her baby swallowing frequently during breastfeeding. Warning signs also includes when the nipples are painful throughout the breastfeeding, if the baby seems to be breastfeeding all the time or consistently falls asleep within a minute or two at the breast, and the mother doesn't feel as if her milk has come in by day 5. For the follow-up care, important follow-up time should be by 2nd to 4th day after birth or 10 to 14 days after birth. At these appointments, check the condition of the mother and the baby, observe a breastfeed session, counsel the mother on any difficulties, explain feeding patterns, and encourage exclusive breastfeeding. Health workers can also provide mothers with online or printed information. Please provide key information to the mother and her family on breastfeeding and care of the mother and baby. Also, a list of abnormal signs in the baby or mother which require help, and clear instructions for her follow up appointments. For the community resources, there's the primary healthcare center, the community health workers, the nurses and midwives, peer supporters or counselors, lactation professionals, lactation counselors, educators, breastfeeding clinics, mother to mother support groups, breastfeeding support groups, phone lines, and printed or online support. A new mother may need encouragement from the health worker to look for help and to use the resources and support available. Sometimes a mother thinks she should be able to do everything without needing any help. She may think if she looks for help, it will be thought that she is a bad mother. Please encourage all mothers and remind them that to seek support in the beginning is a part of caring for themselves and their baby. Families and friends are an important source of support for breastfeeding. If possible, discuss with family members about how they can help. However, not all new mothers have family or community support, so it is important for the health worker to assess the support available at home before a woman is discharged, and if possible, talk to the family. Providing mothers with community support for breastfeeding is helpful. Each mother should be linked to breastfeeding support resources in their community. Primary health care centers and community health workers are often near the families and may be able to spend more time with them. Community nurses and midwives will make home visits to follow up with the mother and her baby. If a health worker assesses a more complicated situation, they should refer the mother to an appropriate health care provider. In some communities, skilled lactation support is provided by various health workers. These include the trained lactation workers, lactation counselors, and educators, providing support either through home based visits, breastfeeding clinic follow up, or even classes. Community groups such as mother to mother support groups or breastfeeding support groups help new mothers. Health workers can identify existing groups to work with or encourage women to form groups in their community. And phones can also be useful in providing mothers with information or answer their questions or concerns.